Well, it is an honor indeed, again, to be given this and great appreciation to serve as a panelist in this important ministerial session on increasing commitment towards promoting the South-South cooperation as key accelerator for achieving the ICPD Program of Action and SDGs. The road to Nairobi. Upon the adoption of the ICPD by 179 countries in Cairo in 1994, the Gambia government has formulated and implemented a series of policies, programs, and strategies over the past decades to ensure a shift from focusing on human numbers to improving the quality of lives of Gambians through investment in health, education, nutrition, among other central to our national development priorities. The population development issues continues to occupy center stage in the Gambia's development efforts in fulfilling and demonstrating our commitment to the ICPD Program of Action. The Gambia, in collaboration with partners, has over the years enacted and implemented legislations, policies, and programs geared towards improving the quality of lives of Gambians by promoting gender equality and equity and women's empowerment and ensuring women, youth, and adolescent access to reproductive health and information and rights to access quality education and employment. Such legislations and programs include, but not limited to, the National Population Policy, Reproductive Health Policy, National Family Planning Policy, National Social Protection Policy, National Migration Policy, Female Genital Mutilation and Gender-Based Violence Act. In a bid to harmonize national legislations and hasten the implementation of the respective national, regional, and international commitments on gender equality and women's empowerment, and elimination of all forms of discrimination against women and girls, the government, in collaboration with partners, has supported and promoted several programs, including training of law enforcement officers on gender-based violence-related instruments, sensitization of communities and circumcises on the abandonment of FGM, among others. Consequently, FGM and child marriage has been criminalized through amendments of Women and Children's Act in 2015 and 2016, respectively. And when the new president came, under a democracy, it was entrenched. The National Gender Policy 2010 to 2020, with the objective of eliminating all forms of discrimination, including GBV, was developed. The government has also set up structures to guide the coordination, monitoring, and evaluation of programs on gender mainstreaming and women's empowerment by establishing a new ministry for women, children, social welfare, in addition to the available structures. His Excellency President Barrow promised the activists. I was in the field on the other side when I came to join the province, and we were able to get him commit himself to empowering women. And the creation of the Women's Ministry for us is a great achievement after 35 years of grassroots activism. So I want to express that. Despite numerous gains registered in preventing harmful traditional practices, women and girls continue to be disadvantaged because of sociocultural norms and practices, as well as discriminatory provisions in customary law. Early marriage, which is at 23.8%, continues to hamper the realization of the potentials of adolescent girls aged 15 to 19 years. Female genital mutilation is also a concern, and government continue to implement policies, strategies, and enact laws through working with communities, religious leaders, youth groups, and parliamentarians combat the practice. In relation to the financing of gender equality and empowerment of women, government, with support from development partners and the private sector, have over the years implemented activities culminating in increase in women's access to education, productive resources, and credit. Significant increases have been registered in the number of women in decision-making positions in politics, and increasingly women continue to occupy management positions in the civil and public service and the private sector. Capacity building for potential women leaders to increase their participation in productive ventures continues to occupy center stage in all our endeavors for the inclusion of women and their empowerment. Conscious of the fact that quality health service delivery is a precondition for economic and social development of any nation, strengthening health systems continue to top the agenda of the development of the Barrow government. The Gambia government, through the population program, has also improved access to quality sexual and reproductive health services through the provision of free contraceptive and maternal life-saving drugs, improvements in road networks to address mobility constraints, refurbishment of health facilities and provision of medical equipment and training for health service provided. We want to say thank you to China for being a champion in supporting our healthcare system. In an effort to reduce mortality and morbidity among mothers, infants, and children, the government is committed to investing in community mobilization initiatives aimed at improving uptake of maternal health services and ensure improved access to sexual and reproductive health services. I am glad to inform this August gathering that the government has piloted a community-based project called the Kabilo Bama Initiative, which is a culturally relevant strategy with the aim of increasing awareness on detecting danger signs of pregnancies among members of the rural communities, ensuring male involvement in reproductive health, ensuring early booking, timely pregnancy tests, and antenatal care. The initiatives also provide support for boosting the socio-economic status of women in the targeted communities. The Gambia has also witnessed a sharp decline in both infant and child mortality, from 75 and 99 to 34 and 54 deaths per 1,000 live births during the period 2003 to 2013, respectively. Similarly, skilled attendance at birth and percentage delivery at health facilities have all increased significantly in the Gambia. On youth and gender mainstreaming, government of the Gambia continues to prioritize youth and women empowerment and development through creating an enabling environment and series of direct interventions for the actualization of their aspirations. The government continues to partner with partners to put in place measures that promote their health. The government, through the Ministry of Basic and Secondary Education, with support from the UNFPA, supported country population programs, has launched and integrated the comprehensive sexuality education in primary and upper basic school syllabuses to replace the then POP-FLE. This will enhance knowledge on family health and physical well-being among school-going kids. The program is expected to start in the next academic year. With various frameworks of engagement and creating opportunities for youth in the Gambia, respective institutions provide relevant skills, entrepreneurial training, microcredit facility, leadership training, mentorship and apprenticeship to the youth. In addition, through the various fora and affirmative actions, youth in the Gambia take active role in decision-making across all layers of governance, from the local to the national level, where the youth are ably represented by themselves. And that is what is currently going on. In addition, the government, through the National Youth Council, has provided support to regional youth centers in a bid to accelerate youth-friendly sexual and reproductive health information and services for informed choices and decisions. Gambia, in partnership with civil society organizations and NGOs, has carried out a series of sensitization activities on divergent issues, including sexual and reproductive health and greater gender-based violence targeting key community and religious leaders and in and out of school youth. Here, I want to appreciate the efforts of the grassroots NGOs and organizations who are engaged with the communities. Recognizing the importance of the availability of reliable and timely data on population and other development-related issues for the formulation of evidence-based policies, planning and decision-making, government of the Gambia, in collaboration with partners, have successfully conducted successive population and housing censuses and national surveys, such as the first ever demographic and health survey in 2013 and 2003 maternal mortality survey, integrated household surveys, and multiple indicator cluster surveys between 2000, 2005, 2010, and 2018, respectively. Such has been major sources of statistics on demographic indicators in the Gambia to guide the planning and policy formulation process. I want to underscore the importance of the need to review some of these policies in order to improve and contextualize them in the current situation. In an effort to strengthen the statistical system in the Gambia Bureau of Statistics, in collaboration with Ministry of Health, World Bank, UN agencies, and other relevant partners, is currently working on modalities for establishing a functional civil registration and vital statistics system. The CRVS system will register all vital events, including births, deaths, cause of deaths, and marriages, and will facilitate the issuing of relevant certificates as proof of such registration. The Gambia, with support from the World Bank, has conducted, and I want to say thank you for this. I'm so sorry.
Thank you. Thank you. Thank you.